Hey everyone! Today, I want to break down how to read a complete blood count or CBC report, a skill every healthcare worker needs in their toolkit. Let's start with the basics. The CBC is a common blood test that gives me a snapshot of a patient's overall health and can flag issues like anemia infection, or even leukemia. The report covers red blood cells, white blood cells, hemoglobin, hematocrit, platelets, and a few indices like MCV, MCH, MCHC, RDW, and the WBC differential. Sounds like a lot, but I'll make it simple. First up, red blood cells, or RBCs. For men, a normal RBC count is 4.7 to 6.1 million per microliter. For women, it's 4.2 to 5.4. High RBCs might point to polycythemia, dehydration, or COPD. Low, think anemia, blood loss, or bone marrow problems. Next, hemoglobin, your main oxygen transporter. Normal is 13.5 to 17.5 grams per deciliter for men, and 12 to 15.5 for women. If it's low, I suspect anemia or kidney issues. High levels often mean dehydration or polycythemia vera. Hematocrit, or HCT, is the percentage of blood made up by RBCs. Normal is 40 to 54% for men, 36 to 48% for women. High hematocrit, probably dehydration. Low, might be anemia or fluid overload. Now let's talk indices. MCV tells me the average size of RBCs, 80 to 100 femtoliters, is normal. High MCV means macrocytic anemia, usually from B12 or folate deficiency. Low MCV points to microcytic anemia like iron deficiency or thalassemia. MCH is the average amount of hemoglobin per RBC. 27 to 33 picograms is normal. MCHC, measuring hemoglobin concentration, should be 32 to 36 grams per deciliter. Low values mean hypochromic cells, common in iron deficiency anemia. If RDW is high, above 14.5%, I think about mixed anemia types or significant size variability in RBCs. White blood cells next. Normal is 4,000 to 11,000 per microliter. Elevated WBCs, infection, inflammation, or leukemia. Low WBCs, maybe a viral infection or bone marrow suppression. The WBC differential gives me more clues. Neutrophils up in bacterial infections, lymphocytes in viral monocytes for chronic inflammation, eosinophils in allergies or parasites, and basophils in rare cases like chronic myeloid leukemia. Platelets are last. Normal is 150,000 to 450,000. High counts hint at inflammation or post-surgery states. Low counts could mean dengue, bone marrow failure, or DIC. Let's put this into context with a few cases. Low hemoglobin, low RBC, low MCV and MCH, but high RDW, classic iron deficiency anemia, microcytic, hypochromic. Now if I see low hemoglobin but high MCV, think vitamin B12 deficiency, macrocytic anemia. If WBC is sky high, immature cells pop up, and platelets are down, leukemia jumps to mind. So my top tips: always look at HB, HCT, RBC, and MCV together for anemia types. WBC and differential help localize infections. Platelets are crucial for bleeding risk, and always tie it back to what the patient is feeling: fatigue, fever, bleeding, because numbers only tell half the story. Thanks for watching, and remember, CBCs are powerful, but only when I read them in the full clinical picture. Catch you